Hi, I'm Melissa and this is The Book Break. Today we are here to talk to one of my favorite authors, Dr. Joseph Q. Jarvis, about his book, The Purple World. Let's go talk to him. All right, Joe, one of the things I love about this book is you tell stories to illustrate our wonderful healthcare system, right?
Oh, it's so awful. I think every family has a story, don't you?
Yeah, I do. I have lots of them. There's one of the stories in this book brought me to tears. Actually, you kind of brought me to tears a couple times.
Yeah. I hope that's okay.
Yeah, that's fine.
Okay.
So tell us the story of the woman that had the hysterectomy.
Yes, I met her when I was a medical student. Now, medical students do some of what's called the workup for patients as they come into the hospital. So you meet them, you take a history from them, do an exam, and get them ready for whatever they're in the hospital to do. She had been admitted by a doctor after he had seen her for the very first time that day for a hysterectomy and also the removal of both ovaries.
So what was the indication that made him think she needed a hysterectomy?
She was very young. She was in her early 30s and had pelvic pain.
Like cramps?
Yeah, just like that. And had gone to see him for pelvic pain, and he'd said, oh, well, we just need to take your uterus out, which of course is ridiculous.
Yeah.
It's just wrong.
Yeah.
So I told him that after I interviewed her and had the chart filled out and ready. I went to the library to get some information, some articles about why this wasn't a good idea, and shared them with the doctor, who chewed me out for, as a medical student, what was I thinking that I could tell him what to do. He's the attending physician,
wow.
The doctor. And I said, well, fine, but I don't agree with this surgery, so I think I'll just back out of the case. And
yeah.
He threatened to have me fail medical school if I didn't show up at the surgery the next day.
Oh my gosh.
So there I was at the operating room, and medical students are used to hold a variety of devices at the operating table. We have usual functions. What I witnessed was the absolute butchering of this case. He was a general surgeon, not a gynecologist. So he didn't really understand the anatomy of this patient's uterus. And he had 7 units of blood on the floor before he ever got the organ out. She almost died on the table. In fact, had it not been for the surgical resident who had great hands and quick responses, she would have died. But there you have it. That's classic American, injure the patient sort of healthcare. We have in the United States 400,000 deaths per year due to preventable injury of hospitalized patients. Wow. This patient was almost another one of them.
Wow. And one of the other things I thought was really interesting that you talked about was you compared our healthcare system with when you were working in Nevada. What was your title in Nevada?
I was the state health officer.
And they have brothels that are similar to our healthcare system? you gotta explain that a
all right.
little.
So in Nevada, famously, in some counties, prostitution is not illegal. They had a crisis on their hands when I got there in the 80s, and that was the HIV/AIDS epidemic.
Yeah.
See, that was threatening their business model. Mm-hmm. They needed to do something to project an image that said it's safe to have promiscuous sex in the brothels. So they came up with this idea of testing the prostitutes every month for HIV infection, and they never found an infection.
Amazing.
Yeah, it's astonishing, actually.
Right.
And the people of Nevada blissfully go on accepting that, and now it's what, 30 years later, and it's still true. Every month they say, oh, nope, no problem. We looked, no problems here. It's just nonsense.
And I think, didn't you say were they able to help with the regulations or the testing, or how did that work?
Well, what they eventually did was that they went to the state board of health and got them to pass regulations that said that said they had to test for HIV, which of course they were already doing.
Right.
And that they couldn't be told where to get the test done or how to get the test done, that we couldn't do anything about whether the tests were done, just that the state was requiring it, so that the imprimatur of public health was on this activity, even though we had nothing to do with really how it played out.
Yeah.
Now, the reason I think that's like business as usual in American healthcare is we have a business model, health insurance, that on its face is anti-patient. Their job is to deny care and to make sure that people who need care don't get health insurance.
Yeah.
That's what they do in order to make a profit. And yet they have to turn around and persuade the American public with PR that somehow this is the only way to do it right, to do care right. That's exactly what is like the Nevada brothels. They persuade the people of Nevada that this is all safe and lovely, and in fact the risk goes up with the more people use the brothels. Likewise, the more people use health insurance, the more the risk occurs for bad events, toxic events, financial toxicity, and other kinds of problems. Health insurance business model sucks.
Yeah. So what is the solution that you talk about in your book?
Well, I propose state-based single-payer health system reform with the support of the federal government. So we passed some legislation through Congress that allows states to do this, and the federal government then provides a lot of funding and a minimum standard for how it's done, and that each state then executes it and does the additional sort of policy innovation on their own.
And there is a piece out there right now trying to help with this. What is that bill?
The bill that I like to refer to at the federal government isn't the Medicare for All bill, which is out there, but the State-Based Universal Health Care Act that would allow states to do this. It hasn't yet been filed in the current Congress.
Okay, so we're going to work on that.
We've got to find a sponsor and we got to get going.
Okay, so to learn more, they can go to thepurpleworld.com, right? And drjosephqjarvis.com.
That's right.
And what's your, you're on Twitter. What's your Twitter handle?
At Dr. Joe Q. Jarvis.
Okay. Well, thank you so much, Joe, and I always enjoy talking to you.
Lovely.
And I hope you enjoyed listening again. Go check out The Purple World. This is The Book Break. Have a great day.
Becoming an author can open more doors than you can possibly imagine. I've seen amazing opportunities come to writers and business owners once their books are published. It can explode your credibility and expand your audience and clientele across the globe. And it can pave the way for future book deals or land you a spot on the bestseller lists. But to get those results, you have to go beyond just grabbing your reader's attention. You have to lock onto their emotions and deliver a transformative experience. I'm Angela Eschler, the founder of Eschler Editing, and we know what it takes to get there. Whether you're a busy professional who needs help finishing that book to support your platform, or you've been dreaming of seeing that novel on the shelf since 3rd grade, you want your book to be powerful, to be read, and to make an impact. And at Eschler Editing, that's what we do. Whether for your family, to build your business, or to share your creativity and talents with the world, your book is your legacy. It's worth investing in. Here are the 2 most critical ways we can support your goals. 1, we can help you make that emotional impact on the reader. Professional editors can go well beyond fixing your grammar, punctuation, and spelling. In addition to helping you capture your authentic voice, we can make sure your stories and ideas are compelling to deliver an experience for your reader. It doesn't matter if you're writing about socks or sci-fi. On some level, you've got to make that emotional impact. The second thing we bring to the table is an in-depth understanding of the publishing industry, so we can help you choose the best path to reaching your ideal readers. This means we understand the real pros and cons of self-publishing versus traditional avenues. We can guide you from A to Z in self-publishing and help you avoid those newbie mistakes. Or, if you're hoping to snag an agent and traditional publisher, we know what they want and can steer you in the right direction. And we have industry connections and guidance to help you effectively market once your book is out there. Plus, we'll hold your hand through the whole process. The short and long of it, an experienced editor is your #1 advocate for ensuring your book is ready for the world.